Every year, World Heart Day is observed on 29th of September to raise awareness about heart diseases, which is affecting millions of people across the globe. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospitals, the Health Talk session, where all your health-related queries are answered here. So on this special occasion, let's hear it from a cardiologist what they have to say.
Heart attack, as you know, arises when the blood supply to the heart muscle is suddenly cut off, and it will come suddenly as a severe chest discomfort, and it will slowly radiate to the left hand or sometimes to the right hand, to the jaws or to the back, associated with profuse sweating. And sometimes people may have associated shortness of breath, giddiness, or they may have fainting because there may be changes in the heart rate and blood pressure in the people who are having signs and symptoms of heart attack.
As our age increases, our risk of having hypertension increases, our risk of developing diabetes increases. We tend to become a little bit overweight, and we also tend to become less active physically and more sedentary as we age.
Adopting a heart-healthy diet will go a long way in achieving this objective. By heart-healthy diet, I mean reduction in salt intake in the diet, consuming a lot of fruits and vegetables, reduction in the consumption of saturated fats and refined carbohydrates.
Low-density lipoprotein cholesterol or LDL cholesterol is the most important parameter and which is leading to the risk for heart disease. So, for a person, normal person, we expect any Indian to have an LDL cholesterol in the range below 100 milligrams percent. But the same for a person who has got a heart disease, we want it to be less than 55. And for a high-risk heart disease patient, we expect it to be less than 40. For a diabetic person, we want the LDL cholesterol to be less than 70 milligrams percent.
Basically, these smoking habits leads to release of carbon monoxide, and there are many tar-related substances are inhaled by the person, and that leads to extensive inflammatory activity in the heart, and it leads to the blockages, and it can lead to sudden heart attack.
The simple modifications like changing the diet plan, reducing the processed food, stopping the smoking, and reduced excessive alcohol consumption, and a compulsory physical activity every day, at least 30 to 40 minutes of brisk walk, jogging, a game, whatever people like, and having a good sleep is directly related to the healthy individual.
A daily dose of up to 3 grams is supposed to be very useful in maintaining your heart health. It helps to decrease cholesterol levels. It helps to decrease blood viscosity. It has a potent antioxidant effects. It helps to prevent cardiac arrhythmias, and it also decreases the risk of sudden cardiac death. It also potentiates the benefit of cholesterol medicines.
So alcohol consumption leads to several deleterious effects on the heart and the cardiovascular system. First of all, consuming alcohol leads to spike in blood pressure, also contributes to stress by increasing the heart rate and also the sugar levels in the body. Excessive consumption may lead to weight gain, sleep disturbances, mood swings. All these contribute to stress on the cardiovascular system.
So commonest risk factors which cause heart disease are diabetes, hypertension, smoking, dyslipidemia, that means high cholesterol levels, sleep apnea, lack of exercise, that is sedentary lifestyle, excessive stress.
Diabetes increases somebody's chance of getting a heart problem by more than 2 to 3%, and 70 to 80% of sudden death is related to heart-related complication in diabetes.
Fiber is a very important constituent in the diet. As per the recommendations, we need to consume about 30 grams of fiber per day in men and about 21 grams of fiber in women above 50 years of age. So what are the benefits of adding fiber in the diet? So basically, they fill your stomach and promotes weight loss. They lower the blood pressure. They also lowers the LDL cholesterol, which is called as bad cholesterol. They also promote gut-friendly bacteria and also reduce constipation in the diet.
the best way to manage stress would be to take a walk, do some stretches, do some exercise, listen to music, take a break from work, relax, meditate, and then probably enjoy a food, enjoy a meal with your loved ones or with a close friend. And probably that's the best way to break the stress.
Chronic high blood pressure years together would increase the muscle mass of the heart and lead to failure of the heart. This is one. Other one is it can narrow down the blood vessels and cause heart attacks. This is called coronary artery disease, and this results in acute heart attacks. And the third point is high blood pressure can damage the muscle of the heart and lead to expansion of the heart and heart failures.
Doing a basic screening test like an EKG, they call it as electrocardiogram, a 2D echo, that's an echocardiogram, and sometimes a stress test like a treadmill test will help us to diagnose an early heart diseases and helps us from preventing a major heart attack.
So importance of identifying heart problem in the early stage can save the life. So particularly if the heart attack is diagnosed early, if the people are aware that any type of chest discomfort or any indigestion, sweatings or breathing discomfort, if they can approach medical services early so that we can recognize heart attack in an early stage, which may prevent a life loss and which may reduce the morbidity.
If you're working in an office and if your office is in the third floor, I suggest to take stairs instead of taking a lift. This is one. Or if you happen to travel by public transport, try to park your vehicle at least half a kilometer away from the bus station or a metro station and walk to the station so that at least you try to get some exercise when you sit and do work. And I suggest at least every half an hour try to get up from your desk, move around, stretch your arms, stretch your legs, and that would also help you to keep you healthy.
The ideal weight limit for each person is different, and it depends upon what we call a body mass index. Body mass index is calculated in relation to the height of a patient. It is very imperative to maintain this BMI in an ideal range that is between 19 to 24.5.
హార్ట్లో ఛానలోపతీస్, కార్డియోమయోపతీస్ అండ్ హైపర్కొలెస్ట్రీమియా, ఈ మూడు కారణాల వల్ల హార్ట్లో కండరం వీక్ అవ్వచ్చు, హార్ట్ ఫెయిల్యూర్ దారితీయవచ్చు, లేదా కొలెస్ట్రాల్ లెవెల్స్ బాగా పెరిగిపోయి హార్ట్లో బ్లాక్స్ రావచ్చు. ఛానలోపతీస్ హార్ట్లో కరెంట్ జనరేషన్లో ప్రాబ్లమ్ అయ్యి సడన్లీ డెత్స్ అవ్వచ్చు.
Diabetes will affect the heart in three ways, particularly diabetes heart disease. It includes acute coronary syndrome that will cause acute MI. The many patients will affect with acute MI nowadays due to uncontrolled diabetes. Second thing is cardiomyopathies. The cardiomyopathy itself, it is weakening of the heart. Third one is diabetes will affect the heart itself. It is cause heart failure. And last one is peripheral arterial diseases.
The most important thing as per the guidelines is to have at least 4 to 5 servings of fruits and vegetables per day. Which are the best fruits for the heart? Apples, papayas, guavas, oranges and pomegranates are good. The sugar should be very less, carbohydrate should be very less. There should be no bakery foods in our diet. So we should be very careful with diets.
Everyday exercises improves the not just the exercise capacity, but it strengthens the heart muscles. Second important thing is it improves even the lung function and hence the overall oxygenation to the body. It improves the bone and muscle functions if the patient is having other risk factors like cholesterol problems, obesity, blood pressure. All these things are also reduced by doing everyday exercises.
If somebody is dehydrated, the heart has to compensate it by increasing its heart rate, and that puts a strain on the heart. If somebody is hydrated, the chances of developing heart failure are less. So being hydrated is the most important thing. Somewhere around 2.8 liters to 3.5 liters is enough. However, those who are working outside in a humid environment, hot environments, working outside of ACs, their daily intake should be more.
Generally, it causes a lot of variation in the heart rate. It also decreases the heart rate variability. And the major factor with continuous stress is hypertension. That is seen in younger patients. Acute stress also can cause something called as stress cardiomyopathy. That is a weakening of the heart muscles.
When a person sleeps, the blood pressure and heart rate are regulated and the body repairs itself. This contributes to cardiovascular health. Disturbed sleep patterns like irregular sleep timings, sleep apnea, or insomnia can lead to disturbances in heart rate and blood pressure.
CT coronary angiogram helps us to prevent the heart disease early by identifying it early. If you find a blockage within the heart blood vessels in the CT coronary angiogram, we have a very effective tablets to prevent its progression.
So remember, taking charge of your heart health is well within your reach. Follow a healthy lifestyle and prioritize your heart today. So this brings us to the end of this episode. Hope this episode was both informative and inspiring, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.